Hello, my name is Graciela Jauregui, and I am a dual graduate student in the College of Public Health with a concentration in Public Health Policy and Management and in the Department of Mexican American Studies with the concentration of Latino Health. Today, I'll be discussing my Master's Public Health Internship project with the Office of Board of Health at the Arizona Department of Health Services. My project consisted of creating a gap analysis between the U.S. justice system and the Mexican healthcare system through binational tuberculosis collaborations. The Office of Board of Health has a mission to promote and protect the health of all border area residents through public health practices along the Arizona-Sonora border. They do this by coordinating and integrating public health program efforts to identify, monitor, control, and prevent adverse health events in border communities. The program that I specifically worked with was the Arizona-Sonora Meet and Greet program, which is a binational tuberculosis treatment program in Pima County. This program ensures the continuity of care and treatment on active or suspected tuberculosis cases for detainees in U.S. Immigration and Customs Enforcement Centers who will be deported to Mexico. Through the Meet and Greet program, patients are offered resources to continue their treatment in Mexico. Along the U.S.-Mexico border, people share similar cultures, economies, health issues, and infectious diseases. Binational collaborations are designed to address collective health issues and increase public health coordination between countries. The purpose of my internship was to examine binational tuberculosis programs and explore how these programs collaborate on public health issues which pose a great danger to populations in Mexico and the U.S. Through the Arizona-Sonora Meet and Greet Binational Tuberculosis Treatment Program at the Office of Board of Health and other binational collaborations in Arizona and across the 4 border states, this gap analysis explores the inconsistencies between the U.S. justice system and the healthcare system in Mexico that do not permit efficient partnerships between the two countries. The objectives of this internship were to conduct a comprehensive history of the Arizona-Sonora Meet and Greet program, to learn what other counties outside of the Meet and Greet program are undertaking when they encounter undocumented individuals with suspected or active tuberculosis, to collect data on similar tuberculosis programs in the states of California, Texas, and New Mexico. Learn how Mexico, specifically Sonora, addresses TB detected cases outside of the meeting program. Understand binational collaborations between Mexico and the United States in the field of public health. Create a gap analysis of the U.S. justice system and the healthcare system in Mexico. Propose suggestions to improve the gap analysis of the U.S. justice system and the Mexican healthcare system. And provide future recommendations that can potentially benefit existing and future binational programs. Data collection included meeting with the Office of Board of Health, key informant interviews with 5 different counties in the state of Arizona, field observations in binational meetings, and the evaluation of existing international health policies across the border states. Binational programs across the U.S.-Mexico border have been successful in preventing the spread of communicable diseases. Although all programs reported positive progress controlling TB on both sides of the border, gaps were found between the U.S. justice system and the Mexican healthcare system. These included not having a mutual understanding of the importance of finishing tuberculosis treatment, not sharing the same laws and policies for infectious diseases, inconsistent hours of operation, communication gaps, and lack of funding for these types of programs. This project highlighted the importance of binational public health collaborations in order to address shared public health issues like infectious diseases in the U.S. and Mexico, the importance of communication, coordination, and mutual understanding with binational programs. Lastly, due to the distinct manner by which the U.S. justice system and the Mexican healthcare system operate, both countries will make slow progress in closing these gaps. I would like to thank the Western Regional Public Health Training Center for the funding to complete this internship, the Office of Board of Health, and my preceptor Robert Guerrero and his assistant Guadalupe Villascusa. In addition to my internship committee, Maya Ingram and Tomas Nuño, and my advisor Jill Gerson de Sapien. If you have any questions about this project, feel free to contact me at the following email.